ketamine is like water for the dry soil of the brain. Or, we have these pathways in our brain that we ski down every day, and we just go deeper and deeper into these carvings. Ketamine's like fresh powder for the brain, right? And you've probably heard very similar things for the whole scope of psychedelics.
Welcome to the Multiverse, where we believe that mushrooms can actually save the world. Each week, we'll be meeting with thought leaders and experts to extract the best insights and stories across everything from functional fungi, psychedelic medicine, and so much more. Thanks for listening. Step into the multiverse with us. All right. Hi, guys. Welcome back to another episode of Into the Multiverse. I'm your host, Ali Shaper, and today is a really exciting episode because we get a lot of questions about ketamine, and we actually haven't had too many people on the podcast come on and share about ketamine. I have a lot of questions for you that I get asked in my personal life from other people, and also just a lot of questions that I have personally because I'm a huge fan of ketamine and really excited about where the space is going. So today we have Dr. Sam Zand and Derek Du Chesne, who are the co-founders of Better You. And Better You is described, this is what you have on your website. I want to hear your guys' description as well, but ketamine-assisted therapy integration services, and they're providing psychedelic oversight, psychiatric oversight, psychotherapy augmentation, and I think your mission, as it stands on your website, is to shift this medical standard of care from disease treatment to self-exploration and growth, which I love the mission of. So first of all, welcome to the show.
Thank you.
Thank you for having us.
I'd love to start with your stories. If you guys can just do a brief breakdown of your background, how you landed here, and then we'll go into Better You and take the conversation from there. So you want to start?
Sure. So as a psychiatrist, I've been practicing for many years, but I kind of feel in some ways anti-psychiatry. I think we overdiagnose, we overprescribe as an industry. And it's not anyone's fault. We're all trying to do the best that we've learned, but the brain is just brand new science, right? And we're learning more and more every day about the brain. So the medication treatments and everything we've been doing for 40, 50 years, the fact that they haven't changed much until now, it's a really exciting time to really break through and kind of revolutionize what we're doing in psychiatry. So I've been passionate about that for a long time. I started at Johns Hopkins studying public health, and there was a lot of psilocybin research going on at Johns Hopkins. I didn't know that was going to be my calling in the future, but definitely got the influence there. And then as I was practicing with patients, I realized there's so much more to our mental health than what we really have learned in our medical systems, in our schools. It's not just take this pill and, see you in a month or two and hopefully things are going well. Like, that rarely happens. And so Western mental health has brought us to psychotherapy, and I'm a huge advocate of psychotherapy, but what we're learning now about the brain is we've been telling people, take these medications, do this therapy, and things should get better. We found that they're not, because we're learning that the brain is rigid in many ways. When we're not flexible, when we're not pushing our boundaries, and we're not exploring new things in the world, all of a sudden, the therapy work that we're trying to do, it's not going anywhere. It's an uphill battle because we're stuck. We're physically, neurologically stuck. And so this, psychedelic revolution that is upon us has really taught the medical professionals, I think, the most about how we can treat our patients. And so in our practice, I've just seen fantastic results from first Spravato 3 years ago, which was the FDA-approved ketamine nasal spray. I speak for the company as a promotional speaker, and so I know all their clinical studies, and it's night and day difference, the way we've been treating people in the past and what ketamine has done to knock down the door, specifically Spravato as an FDA-approved medication, because now we're all really learning and trying to use these modalities in a way that brings ancient knowledge back. And it's not just what we learned in med school, it's what we've known for thousands of years in sacred medicine. So that's been my passion, my calling. And then, as we've grown our practice, I was lucky enough to meet this gentleman, Derek, and our paths really coalesced in a beautiful way, because while I had the kind of medical background and passion, he went through his own kind of personal journey, and the way it came together, I think, is really strong. So I'll let you share that.
Yeah, absolutely. My name's Derek, and I, prior to this, years ago, was going through this journey with my mom of taking her across the country and trying to find all kinds of different healing modalities to help her with a multitude of things from ovarian cancer, MS, fibromyalgia, more recently early onset Alzheimer's. And that led me to finding something that really helped her at a clinic, a cancer pain clinic in Huntington Beach, and something that wasn't really yet legal at the time. And so I started a company called Healing Ventures to help bring products like that, or like different modalities to market and incubate them. So that started that. And then years went on where things went pretty well. And within a very short period, I had a kind of an easy streak for a couple of years, and kind of everything that I was working towards was coming to fruition very well. And then within a very short period of time, I went from the person who had it all figured out and my life was kind of on a clear trajectory to professionally and in my personal life, kind of things did a 180. And I didn't realize it at the time, but I identified who I was as a person with my business and with my I was planning on being married, and once that was kind of took a 180 on me, my identity was really tied to that, and I never thought depression or suicide would be a part of my life or vocabulary, and I kind of just spiraled out and mentally, and nothing was helping, and I just couldn't understand anybody, and nobody could understand me. And a friend of mine dragged me into a ketamine clinic, and my first thought was, I don't need a horse tranquilizer. This is stupid. I'm not doing this. And my whole ethos is plant-based medicine, and I went in, and I had that one session took me from this unrecognizable version of myself to, underlying issues were still there, right? But I was 90% back. It just completely snapped me out of this funk and allowed me to process and break out of this repetitive just shame and blame and just these dark holes that I was spinning in my mind. And then it was $1,500 a session. There was no treatment prep. There was no integration. There was, they plugged me in, sent me out. When I asked them afterwards, I'm trying to unpack, and they're like, "What are you doing next week?" That was the integration. And so I was like, "This is phenomenal." I wanted to learn more about it, and went up to Stanford and then met a lot of incredible people at the Psychedelic Research Institute. Found out all kinds of amazing things about ibogaine and MDMA and LSD and all kind of the future of what it looks like for mental health and humanity. And then cross paths, was connected with Dr. Sam Zand over here, who's been doing incredible work with a lot of patients and helping people transform their lives and releasing after the same patients that he was working with for quite some time, not having these breakthroughs, and then in a very short period doing it with ketamine. And we put our heads together, and now helping a lot of people.
Wow. And so previous to you having your first ketamine experience, you had explored other psychedelics, but mostly sounds like plants and fungi. Or was this your first real psychedelic experience?
So this was, it explored on psilocybin. It explored a lot of the non-psychoactive, on the pharmacological benefits of non-psychoactive cannabinoids, like CBN, CBG, those types of things, years before, or even CBD before it was legal, and bringing those to market. Psilocybin, we were working on doing an R&D facility here, and that didn't come to fruition. And big believer in the and everything, psilocybin. But as far as my goal is to how can we help as many people as possible, and without having a legal path forward with psilocybin yet, and seeing how much ketamine helped me. I really shifted my focus to this, and right now, ketamine is the only legal thing that we can prescribe to treat, psychedelic. And in the future, we're very excited for FDA guidance so that we can move forward and prescribe, what's next to come.
So I think this is a good point to actually break down ketamine. You hear a lot of, even I've listened to a lot of podcasts where people come on and share their stories around how ketamine has improved their mental health. I had a lot of aversion originally to ketamine because of the basic understanding that it is man-made. We hear the reference around horse tranquilizer.
Yeah.
It sounds like you had a similar concern.
It sounds dirty, right?
It sounds dirty.
I didn't want like anything to do with
It's
that.
not a pretty name.
No,
it's not a pretty name.
Mean is in the name.
Yeah,
Ketamine.
nice. Yeah, Ketamine.
Yeah.
Maybe that's a good rebrand.
Yeah.
That'd be a great clinic name. But I'd love to actually like get really nitty gritty on what ketamine is, how it affects your brain, the negatives of ketamine, if any, and dosing, usage, all of that. So if we can kind of just like start from the top, and it sounds like this is your area of expertise to actually giving a descriptor, but like what is ketamine, and when you either inject it or consume it through a lozenge, there's multiple ways that you can consume ketamine. What happens to your brain?
Sure. So let me start by saying how I was introduced to ketamine. It was about 5 years ago. I was treating patients in my practice. One gentleman came in and he said, I just left my old psychiatrist. I asked why. He said he kept trying to give me ketamine. I thought, how negligent. What is this guy doing? Should I report him? Because I just didn't know, right? To me, ketamine was just that, a horse tranquilizer, a rave drug, a party drug. And even as a practicing psychiatrist, I was caught off guard because we weren't given that education until, as we alluded to 3 years ago, it got FDA approved. And then all of a sudden the education comes pouring in, the clinical trials, how this is helping people. And so let's start with, what is ketamine? It is, as you alluded to, a synthetic compound. It is a chemical compound. However, it's so closely related to many of these plant-based psychedelics.
Which ones in particular?
Sure. I think all of them share the properties of neuroplasticity that's very common and popular now, right? And it wasn't 20 years ago. The concept that our brain continues to regenerate, continues to create new neurons and new neural pathways. 20 years ago, do you remember the quote, "Don't kill a brain cell, they don't grow back"? That's what we used to think. Just say no, right? And it caused this whole cultural perspective of drugs that made it okay to take something if a doctor said it, not okay if the doctor says it's not okay, right? And it scrambled our understanding. When you really look at the similarities between psilocybin, between any psychoactive plant-based medicine and ketamine, they share the fertilization of the brain. They share the ability for the brain to create these new, what we call dendrites. There's kind of the little spikes that come off the neurons, and they're ready to communicate with other parts of the brain. When that is not happening in a healthy way, when we're stuck and isolated in the same routine, the same rut, we end up not being able to have that flexibility in mind. So that's why you hear so many colorful illustrations of ketamine is like water for the dry soil of the brain. Or, we have these pathways in our brain that we ski down every day, and we just go deeper and deeper into these carvings. Ketamine's like fresh powder for the brain, right? And you've probably heard very similar things for the whole scope of psychedelics. Now, what is it doing uniquely? There's a neurochemical called glutamate. This is responsible for our brain to be more activated. And that's what makes ketamine unique, is that it does something, an interplay with glutamate, whereas most of these others like psilocybin, they work on serotonin. Serotonin's our happy chemical. Mm-hmm. But glutamate gets us firing. It allows us to optimize our brain health. It improves brain function. Instead of saying, let's dumb down these symptoms, you're feeling anxious, we got to slow you down. You're feeling depressed, we got to speed you up. That's traditional psychiatry. Now we're saying we have to make the brain more optimal so that you can do the work you need to do, whatever that is. And it becomes a much more broad spectrum use. Now, it is only FDA approved for depression, but off-label, we see tremendous benefit for anxiety, PTSD, pain. And so
Spravato is FDA approved for
FDA approved for treatment-resistant depression. And so you think about, okay, what happens when I'm doing this in the rave or the club, and why do the kids do this? It's a night and day difference, right? When you're doing it in a therapeutic session, mm-hmm. eye mask, headphones, therapist, guidance there with you, setting your intentions, all of a sudden you're creating the seeds of the new thoughts, the new feelings, and the new behaviors that you want to kind of instill in your life. And ketamine is such a gentle introduction to be able to do that. You can do it at a low dosage range, and it's mildly dissociative, a little bit of like an enhanced meditation. You can do it in a high dosage range, and it becomes more psychedelic. And so like many of the others, it has a wide range of properties that we can tap into, with more understanding and more guidance.
What are the main form factors of how you can consume ketamine? We named a few of them, but if you can kind of like break down the range of,
Sure.
I've heard people consume ketamine a wide variety of ways, like anything from like anal insertion to like intermuscular to lozenges to powders, like to nasal sprays. Like, can you break that down? And you can, obviously some of these are not recommended in therapeutic setting, but like what is the range?
Education's important.
Yeah, like what's the range of how people are consuming ketamine and what's the safest?
10, 20 years ago, ketamine really primarily started in the infusion clinic. Pain doctors realize when we give ketamine to people, all of a sudden it's just resetting their neurocircuitry and their pain threshold is going up. They're not feeling pain as frequently, as severely. In the infusion form, directly into the blood, you have 100% bioavailability. You also have the injection, which is almost 100%. So if you go to an expensive ketamine clinic right now, brick and mortar, you're probably paying $1,000 more or less for either an infusion or an injection. You're getting 100% of it in your system. You're getting it quickly. And you're getting the medical supervision that I agree is a good thing to have. The FDA-approved Spravato comes in a nasal spray. And that one is, you have to be in clinic. You can't get that sent to your home. So you have to go to a registered location. You do about 4 to 6 puffs in the nostril, just like a Flonase. And then it also kicks in pretty quickly, about 5 to 10 minutes. What we've pioneered is the at-home oral absorption. So you have either a lozenge or an oral dissolving tablet. You put it either under your tongue or between your cheek and your teeth, and you hold it for about 15, 20 minutes while doing the relaxation, the breath work. And in that time, it's slowly kicking in through the mucosal membranes of the mouth. Now, the percentage bioavailability is a little bit lower. You get about 1/4 of the dose, so we increase the dose to account for that. No matter what modality you do, you're getting this very similar experience, just a different method of administration.
And does better you have an opinion on, like I know that people are not coming into your clinic and snorting ketamine, right? But that is the most common way that people are using it recreationally, as far as and these few other methods that I shared as well. Like, is it doing the same thing? Is there danger in, let's say, someone snorting ketamine versus using the lozenge versus intermuscular? Is there any downside across any of the ways that we can consume it?
Sure.
I think there's a world of difference between drug use and drug abuse, right? And when they're being used in therapeutic settings and coming through, fentanyl is rampant right now, right? Especially in large cities like Los Angeles, right? And a lot, it's something that's growing more and more. And I think on harm reduction alone, even for recreational users, it's a very scary thing, right? You're playing Russian roulette every time they're buying any type of white powder and snorting it. So I think that's something that's very concerning. In the clinical setting, it's never prescribed as a powder to ingest. There's the nasal spray, which we don't prescribe because there could be abuse potential for that. Spravato, which is a nasal spray, which is a derivative of ketamine that's done in office, that is supervised, and the IMs, like we do the IM injections in office, and even with the troches
the lozenges.
Because of the way that it has to be administered and holding it in your mouth for 12 or 15 to 20 minutes, even if somebody because it's kind of a ceremonial or ritualistic type of thing, and going into it, pre and post, that it's something where I think it takes away from that kind of the instant gratification or instant abuse that somebody would be doing with a nasal spray or powder.
I fully agree. And I think that major difference that you alluded to is, if you're doing a drug recreationally, how do you know how much to do? How do you know when to stop? And if you're just snorting something, you go an hour and you're like, that felt good, let me do it again, right? And this is set up in such an intentional way. You called it ceremonial, and it really is, because you plan your whole day for this treatment. Whereas the abuse potential of a powder that you snort, it might just be impulsive. You might just get triggered and feel like I need to escape. And I see my powder right there. And that's the abuse potential of drugs versus a regimented program that you're planning ahead for.
I'd love to double click on this a little bit because I know many people in my life that appear to have a ketamine addiction. And I know a lot of people that ketamine is massive for their mental health. It's been massive for my mental health. I'm, a patient of a ketamine company, which I want to talk about the whole D2C ketamine model and like go into the necessity of therapy in parallel with ketamine as well. But we'll kind of like table that for a second to just talk around like the negative effects of ketamine, if there are any, right? And I do, really believe in this clear differentiation between the drug and addiction. And Carl Hart has a great book called Drug Use for Grownups, which I spoke about at the dinner that Derek and I were at, and really a huge fan of his work and the way that he differentiates between those two categories. However, that being said, due to the legal nature of ketamine, the access that, that the general public has to it, whether you are a patient of a ketamine telehealth company or you get street ketamine, however you access it, I definitely know people that appear to have a problem with it. And I wanted to kind of break that down around like, what are your thoughts on that? And also, are there any negative effects of overuse of ketamine?
Yeah. First thing to make clear is that when we prescribe it therapeutically, it's taken once or twice a week max. So when you go above twice a week, we don't have any safety data that suggests that it's okay or not okay to do that.
And do you have safety data on the fact that 1 to 2 times a week is safe?
Yeah.
For like how long of a period of time in theory?
Actually, the Spravato just came out with 4-year safety data that shows after 4 years, patients who've taken it up to once a week have shown no long-term health risks, significantly, different from placebo.
Can I ask one more question on that point before you? So rumor, right? But want to clarify. Because I was asking around, like let's say someone takes ketamine every weekend for a year, whether it's really intentionally, ceremonially, but like the system, the compound is in their system every weekend for a year, which is often like what these protocols are prescribing, right? Someone was sharing that there's a risk that maybe it could crystallize in the liver if you consume way too much of it. Is that a rumor? Is that true? Have you seen any liver negative
dosage is very important, right? And when you're like I said before, drug use and drug abuse, right? So under the clinical typical dosages that are prescribed, and then also if they're ingesting or not ingesting, I think are two kind of critical factors with that. But if somebody is consuming and I know some of the same people you're talking about, right? And and it's something where drug, it is. We're not pretending like it's it's a flower, it's not roses that you're picking, right? It is a drug, and it is a powerful drug. And while they're like many drugs, have incredibly therapeutic benefits when done properly in the right dosage and the right guidance and the right supervision, it's if you take a whole bottle of Tylenol, you're going to die, right?
Right.
So dosage is very important, and frequency.
Yeah. And so to go to your question, if you're taking the therapeutic dosage, you're not going to have these health risks. It is processed through the liver. So if you do too much too often, you're going to have liver problems. It affects the bladder if you do too much too often.
Bladder cystitis.
It affects your blood pressure if you do too much too often. But again, when done in infrequent intervals, and that's the beauty, we're telling people, stop taking these daily medications and do this once a week. And while Spravato, for example, their indication is twice a week for the first month, once a week for the second month, and then once every 1 or 2 weeks after that, forever is what they say, right? And that's for treatment-resistant depression. Now, we don't agree with the forever part of this because we feel you're a dynamic individual. We all are. And so to diagnose someone and say this is what they need for the rest of their life, we're drawing a conclusion that this person's static and they're not going to change, right? So our protocols, what we encourage people is give this a try for a month, maybe 2, maybe 3, but then certainly take time off because we don't want you to just need this for the rest of your life. We're not in that business. We want this to transform the rest of your life. And so usually a lot of our clients after 3 months, they're like, that was fantastic. I got the reset that I needed. And maybe I'll come back to this in another 3 months or another year, or maybe never again. And we root for that. It's not good business, sorry, but that's what we want. We're a healing company. We're not, a profit driven, greedy company. And so that's the difference, I think, is that a lot of society is being told you need to do this all the time. And we're used to that. Take your meds every day, take your vitamins every day. But this, in fact, your body knows when you need this. It knows when you need that healing. And if it's just once a month or once a year, that might be just enough for you.
And some people, they'll do a couple sessions and they're like, wow, that was incredible. I feel like I'm in a really good place. I don't need to continue on.
Mm-hmm.
Or other people, it'll be a couple months to get them to that place. But part of our process isn't just, while the medicine is powerful, it can do incredible things. Like we have people that, they don't leave the house, right? They don't go outside, or they don't sweat regularly, right? And so we look at their diet, we look at their movement, and while they can have really positive experiences with the ketamine treatments, like this is amazing, like okay, well, nothing's going to substitute sunshine and movement, right? And so we look at just their habits, and then help them set goals, help them finding lasting changes, because while you can find this relief, potential relief with this kind of treatment, it's not going to change their life or lifestyle unless they, while they're in this heightened state of neuroplasticity, and really put forth the effort to change their daily habits. And sometimes, things can be easier to make that switch, during these states. So it's something that we put a very heavy focus on.
Yeah. And so to go back to side effects and risk potential, there's certainly many. If taken the appropriate way long-term, we've seen all the data, this is safe.
And on the long-term note, what dosage is that study on? Like I believe you said the nasal spray.
That's a good question. Yeah, it's 56 to 84 milligrams in the nasal spray. And that's just what they've clinically tried and approved. There's a wide dosage range in the community, but some people go under that. And, usually that's more just for kind of a anxiety relief, meditative type feeling. Some people go higher, and that's where you get that more psychedelic experience that gives you a perceptual, understanding of, this is the way I was looking at things. Do I have to maintain that perspective? We think there's value in all of that. The study that I alluded to has no psychotherapy associated with it. And so the safety and the efficacy were proven without any therapy involved, which again, we believe so much better with the therapy, so much better with the lifestyle modifications. And I can do therapy for somebody for 5 months. And as a provider, I know where to guide them and what the conflict points in their life are that they may not be aware of. But therapy isn't me just telling that person about it and them being like, oh, thank you. It's finding it out for themselves. And what might take 5 months in weekly therapy, we're getting the same results in 1 or 2 sessions, because our guard is down. Our default mode network is dissolved away. All that background clutter, the emotional baggage we hold on to, when that's no longer in the way, then we have the answers, right? We have the ability to heal ourselves if we can get out of our own way. Having said all of that, let's talk about the side effects. I think it's important. Nausea, just like a lot of psychedelics, not nearly as much as we see with psilocybin, because with psilocybin, it's a serotonin emulator. You have serotonin receptors in your gut. And so very commonly, a lot of people might have nausea from psilocybin, and they still can with ketamine. We give ondansetron, it's an anti-nausea that they can take before. Blood pressure goes up during treatment, maybe 10, 20 points or so. So if somebody has acute cardiovascular risk, they're not a good candidate. If you have uncontrolled high blood pressure, if you had a recent stroke or a heart attack that hasn't been addressed as to the contributing factors that caused it, we certainly would not want that person to do ketamine. The other big side effect is the physical dissociation. So mentally, we're in this kind of other realm. Physically, we're also pulled away from our body and into our mind, so we're left feeling weak and wobbly. And that's why for our at-home protocols, it's so important that they are required to have a peer support present with them in case they need to get up and go to the bathroom. The most dangerous thing that can happen is an accidental fall. So we build all the precautions for that. Other than that, some people might have a little confusion, a little headache, maybe a little brain fog, but usually the opposite is more common. People feel inspired, clear-minded. You may know from your experience that every session can be different. The priming and intention setting going into it is so important to allow the subconscious mind to gently kind of surface into the conscious mind, and then we can process those things.
Yeah. So my experience with ketamine, and I'd love to to hear your version of how you describe this. I feel that when I've, undergone, I've done ketamine intramuscular therapy. I've also done lozenge with therapy as well. And what it does for me is allows me to like take this 3,000 foot view perspective over my life and really see how all the pieces kind of connect. And it's been incredible for business, for relationships, for like this whole variety of things, right? And I don't know exactly how to describe, it's difficult to put words to psychedelic experiences. A lot of those really profound realizations have been at lower dosage. I'd love to hear your perspective on dosing and also just personal experience of like how you would describe your own journeys. And maybe that's a good question to start with. Derek, you mentioned you had this really transformational experience. What dose was that at? And how would you describe kind of your takeaways from the experience?
Yeah. My first experience was done in a clinic, and that was an IV. There was no treatment prep, so I'd go in there and start kind of unpouring my heart of like why I'm there, and they cut me off kind of 2 minutes into it. And it's like, have you ever done ketamine before? No. Have you ever done mushrooms before? It's like, yeah. Oh, you'll be fine. So they bring me in the room, plug me in. At that time, I was probably, at least 15 pounds skinnier than I am now, which isn't not much to lose here. So I wasn't eating, I wasn't sleeping. I just wasn't in a good place. Wasn't really functioning. And I went from, hyper functioning to just not. And that session, and it's like, it was such a strange few months of my life because I just never understood like depression. I understand we all go through traumatic things. I understand like life has ups and downs, and kind of always been able to easily, process and comprehend things and get through them. And at this particular point in my life, with these particular external stressors kind of happening at the same time, I just lost it. Right. And felt like I was drowning and everybody else around me was breathing. And it was just didn't recognize the person that I was. And
you had a high dose when you did that.
And yes. And so this is an IV, and I think it was about 100 milligrams, 150, 100, so somewhere around there. But it was, I literally left my body entirely. It was like almost not Mario Kart, but almost like, in Star Wars when you're flying and you go into light speed, but it wasn't like all white. It was like oranges and blues. And it was like this beautiful kind of, I don't know, intergalactic highway that I was on. And I felt like all of that repetitive, dark, like, these negative, disempowering thoughts, they were all gone. And like you said, like I was able to get this perspective shift, right? And this 30,000 foot view of like, maybe, like life isn't so bad. Maybe I'm not so terrible. Maybe a lot of these things that I'm drowning myself in, which I don't think I ever intentionally was like, drowning myself in it, but my brain just went there. And it allowed me to just step away from all that and let go. Like it's the first time I felt like I was able to breathe in so long. And and it was really, like, I don't think even before having that ketamine session, and I was on the go so much for work and traveling so much for work. And I don't think if ever, even during meditation or anything, I don't think I've ever spent that kind of quality time with myself. Right. And gave me clarity on things in my life that maybe don't serve me, or things that like maybe I was programmed, or friends or family, or maybe things that like I did because I thought, I was supposed to enjoy these things, or these are supposed to be a part of my life. And, and all of that was like, I was able to kind of quiet all that noise and spend time with myself. And after this, I just felt like, I just came out of this shell and kind of looked at this person that I had been for the last couple of months and was like, what? That is not, that is not me. Let's start, I went for a run that day, and like, it was just, I was back and still had some things to deal with, but yeah.
So that was your experience with a high dose IV.
Mm-hmm.
What's interesting is your question alludes to like, what is the right dose for the person? Is a low dose beneficial? Is a high dose beneficial? And I think the answer is they all have their own value and purpose. The problem becomes if you go to an infusion clinic, they're not going to give you a low dose, because as a business, if I give you a low dose and you didn't feel it and you just paid me $1,000, you're going to be upset. So they tend to dose everybody into the max range when you go to for an infusion. I think what's special about our at-home program is you can start very gently. You can start at a 50, 100, 150 milligram dose, and then just decide whether you're even open to going into that more deeper psychedelic experience. And for many of our patients who they've never even tried psychedelics before, they've come from, again, the overprescription of psychotropics, the antidepressants and mood stabilizers. So it's just, doc, tell me what to do, right? You're the doc. I take the med as you just prescribe it. And we're able to tell them, start very low in your first session. And this is what you're looking for. You're looking to heal. You're looking to let go of any toxins that you're holding on to mentally. As you get into a higher session, we focus more on cognitive behavioral growth. And I think in the higher dosage ranges is where you focus on self-love and self-transcendence. And so we do see value in the whole spectrum, but we don't think you have to go max dose every time. And giving people the autonomy and flexibility to understand what works for them is that customized approach that we've really mastered.
Yeah, I think that's a really good point. My experience with going to, a clinic was I was pushed towards doing a larger dose. I was more kind of like vetting the experience, which I thought was really interesting, right? Because that's very similar to, the Western medical model. Right. The more the better, because the lifetime value. Supersize me.
Yeah.
It's like the lifetime value of a customer.
Double the dose.
Yeah, and I have a friend, Flor Bellini, who's on the podcast. She talks a lot about progressive dosing, specifically as it comes to 5-MeO DMT and others. But I think it's the same across the board. And a lot of what I talk about and care about is microdosing, specifically psilocybin, because I think the slight neuroplasticity, while you are like more cognitively aware while you're in your life, can often be more impactful than like going to visit the cosmos and seeing Jesus and then having to come integrate that into the 3D, so to speak. And I think the same with ketamine. Most of my most profound experiences haven't been complete ego dissolution. It's been more subtle than that. And I, just the last kind of point on the dosing, and then we'll take this a different direction, is it sounds like with the nasal spray, I'm forgetting the name. Spravato, that the dosing and the safety that was tested was at a fairly low dose. And so we have, is that correct?
The bioavailability equivalence is on the lower end. Yeah.
What would that be in a lozenge format that people are familiar with?
So about twice as much for lozenge. So
150.
150.
It's a range, maybe to 200 or so. Yeah.
Okay. And so that's, I think, a really good place to start chatting about the actual dosage that is happening with ketamine, because I know clinics, I know D2C ketamine companies, which have a lot of controversy around them, to be honest. Like, there's a lot of backlash towards just sending people massive amounts of ketamine at home with, with therapy, regardless, massive dose. There's some risk around that. And then B is just sending people massive amounts of ketamine with no psychedelic assisted therapy component with it. What is the max that you've seen prescribed in D2C ketamine, and what are your thoughts on it?
Yeah, I won't speak about who or where we see these doses, but we've seen our patients come to us, and it's all in the pharmacy record. We can look it up. They've taken 1,000 milligrams, 1,200 milligrams at a time, and
1,400.
You've seen 1,400? Yeah.
In a single session lozenge. Yeah. And is that for a first-time patient sometimes?
No, I think it's after they go through the program. So this isn't us. This is what patients have come to us, like requesting that they've come from another program and asking for these, astronomical
and
doses.
Know what? Everybody's different, down to how prepared we are for the treatment. You mentioned your own personal experience with ketamine, and as I've gotten to know you briefly, like, you seem like a very in-tuned person, right? And you didn't perhaps have a lot of those blocks where a low dose worked very well for you because you were already aligned. You're detoxified, I'm assuming, in many ways.
I hope so.
And when people come to us, often they're in, their 30th year of chronic depression with multiple suicide attempts, or they've been chronically anxious for a long time. They've had trauma in a way that they don't even realize how it's affected them. And so a low dose won't even touch them from a experiential perspective to get that perceptual shift. when you went in for your infusion, if you had a low dose, then we don't know. It may not have given you what you needed.
Yeah, but
Everybody's
it wouldn't
different.
give me that breakthrough, right?
Right.
Which at the time was.
And we've heard so many fantastic stories of people who say that when they get to the higher dose, that's when they have their breakthroughs. Someone who lost a loved one, all of a sudden she gets to reconnect in her experience and find forgiveness to absolve any guilt that she felt, right? And does that happen at a low dose? Now, it can with transcendental breath work and meditation and having all the right elements.
Mm-hmm.
But we have to meet our patients where they are. And sometimes they're not ready to have that breakthrough at just a small dose. They need a higher dose. And then after that, they can graduate to a lower dose and come off is the goal.
Got it. What is specifically, like just to talk about Better You for a second, you guys launched in 2021, to my understanding, right?
Mm-hmm.
Or you formed the company.
Mm-hmm.
How many patients have gone through your program? And can you share a little bit about some of the most common takeaways, some of the statistics on, maybe because right now it's for anxiety and depression, right? Is the indications you're treating patients for? Mm-hmm. What is some stories, statistics that you can share about the results?
Yeah, I would love to share some anonymous stories. I think the beauty of the work that we've done in this last year, Derek and I, we started, I was clinician, he was integration guide, right? And we just soaked up as much knowledge and education as we could until we were able to onboard a team, superstar medical advisors and psychologists. And through the course of this, really rolling our sleeves up and being there with our patients every day, we've probably treated over 1,000 patients. And we've had one, I can think of, adverse event where the patient might have had a little bit of a angry, manic type experience afterwards. 1 out of 1,000. Now, he called us, we talked to him, we helped to bring him back to a more stable level. I think those are fantastic numbers to show that the safety in those high volumes is still very low. On the flip side, the benefit, my favorite is when people come to us and say, you know what, I had no intention of having this outcome, but ever since I did my first treatment or a couple treatments, I no longer smoke cigarettes, or I stopped drinking alcohol, or I'm nice to my wife, right? It's like, I love her, and I realized I was adding so much stress and friction to that relationship, and just 1 or 2 treatments, all of a sudden, like, why am I being mean to the person I love? Those are, I think, the most gratifying, when it just comes out of left field and they didn't even realize that what they needed to work on was not in their attention, and this brought it to their attention. That's, to me, I think, the most gratifying. We get a little bit just kind of, I think, used to all of the amazing stories that we hear now, but in the beginning, it was just, as a psychiatrist, night and day difference. Someone came to me and said, Doc, that Prozac you gave me was really helpful. I'm almost like, really? Like, what? It's like, I'm surprised. But when they come to us and say that ketamine didn't work out, we dig in and we say, let's go back to the prep work. Let's go back to the intention setting, because most of the time people are getting benefit from this. 80% plus, we're seeing a response, which is astronomically different to what we're used to in this industry.
Oh, and most of those 1,000 patients have been telehealth, lozenge?
All of them.
Okay. Wow.
And so Sam's been treating patients in office with Spravato and with IV therapy since 2019. And then when we created Better You, we started very slow and working with patients that also were doing IV and then doing the at-home model, right? And when we figured out a program that seemed to be working very well, and very slowly scaled that up. And like you said, I was the person on the phones all day, every day, talking to every single patient after almost every experience for months. Wow. And for me, it's very personal. And when I talk to people that have attempted suicide before, and talk to people that when nobody comes to us because they're like, I'm feeling great, right? They come to us because they're going through it. They're not feeling good. Or a lot of times, like, my favorite thing used to be when people were like, I've tried everything, this isn't going to work for me. And being able to work with them and seeing after a couple weeks, a month or so, for really tough cases, maybe 2 months, and being able to see and be a part of their transformation. And a lot of times people will be like, when we'll start unpacking it after they kind of came out the other side, and they'll start crying, and they're like, I'm just happy that I'm crying. I'm happy that I'm feeling. I'm happy when I'm happy. I'm happy when I'm sad. People, like, all the time, people come to us and they're like, I haven't felt I don't feel a connection with my kids, my grandkids. I don't feel a connection with my significant others. Like, I just feel numb to the world. I've been on so many different pills for so many years, and I'm just like the shell of a human being. One of my favorite people that we work with he told me that before starting with us, he felt like the whole world was in black and white. And then after going through the program, he's like, now I feel like I'm in Wizard of Oz. He's like, I feel like the world is color again, and life is exciting again. I'm kind of reconnected. Like, people say that it allows them to kind of quiet down all the noise in life and really shine light on their purpose.
It's fascinating because as a psychiatrist, I'm tasked with treating the mind, and we can't take a blood test of the mind, right? We can't take an x-ray of the mind. It's a very subjective field that we're in. And more than anything, people sometimes they have a tough time explaining what they're dealing with, right? Awareness isn't a virtue for everybody. And so I'm left trying to have someone who may not be that self-aware describe to me what they're going through. And between the words, it's the spirit that you see in somebody. Someone who's been through trauma and they said, I haven't been able to smile or enjoy anything in years. You see it in their affect. And then after a treatment, all of a sudden, you just see their spirit light up. And it's something that's not quantifiable. I can't put that in a scale or study and publish it. But that's the experience that we see every day, that you can just tell we're changing the kind of consciousness of these people. We're changing the energy fields, something that is not very scientific in a field that, again, it's the wild frontier of, understanding the brain. I think these are the things we need to key in on more.
What is the level of clinical anxiety, depression that someone has to have in order to have access to this?
Yeah, this is a very interesting question, because what you're alluding to is what's the standard of care for this practice, right? Because someone wants to do something recreationally, by all means, that's their right. But if they do it medically, the doctor has to have an indication to treat. And this is something we feel very passionately about, trying to change, trying to evolve. The whole system of medicine is such that we have to say you're sick to treat you, right? It's a disease state model. And what we're trying to shift to, especially in mental health, why are we calling people diseased when they're just struggling with their mental health? They're struggling to pay their bills. They've had some fights in their family. They're having work stress. And all of a sudden, they're ill, they're sick, they're diseased. I don't think that's right or fair for those people. To answer your question specifically, we still have to play by the rules, right? So to diagnose someone with depression or anxiety, there is a severity, mild, moderate, severe, and that fluctuates a lot too. So I would say that most of our patients are in the moderate to severe range of anxiety, PTSD, depression. But sometimes they might show up a little mild. Sometimes they might say, I've had a great few days. That doesn't preclude them from continuing the treatment. But it is a tough area to navigate. And I'll tell you, I see a lot of professional athletes now who, I think mental health has become very trendy in many industries, and professional sports is leading the way. And they might come in because they're dealing with anxiety or they're dealing with depression. But when I see them a week or two after a ketamine treatment, they're telling me how they had the best practice week of their life. They're telling me how it wasn't just the anxiety, depression that they noticed improvement in. It was inspiration. It was motivation. It was, I found joy in what I'm doing. I've changed my interaction with my work, with the world, with the fans, with the coaches. And now I'm able to just hit on all cylinders because none of that background noise is bothering me anymore. And so why do we have to wait for someone to be severely depressed or suicidal to have that kind of optimization? I think we're on the same side of the conversation. But I'm excited to see the progression. I think we're getting there. I think psychedelics are leading the way.
And I think that on that, it's when you tell somebody that they have depression or you tell somebody that they have anxiety, like that becomes a lot of times becomes a part of somebody's identity, right? Like it's cloudy out today. Oh, my depression's kicking in, in traffic, my anxiety's kicking in, right? As opposed to I'm dealing with normal life stressors, and it's okay. Like we're human, right? It's okay to feel certain ways at certain situations or certain things. Like that's normal human emotion. And when people are diagnosed, like, so many outside of professionally, like so many of my friends that are like, oh, I have this, and this is affecting this, right? As opposed to, these are emotions and circumstances or stressors, how do we process them and carry on, as opposed to like, this is now an attachment or part of my identity, right?
Yeah. And you know, the reason I'm kind of asking so much specifically on this front is I know a lot of people that benefit from psychedelics. Most of the people that are in my immediate network are not clinically depressed, anxious. They may have low-grade versions of that, but have all benefited massively from having access to this. So we're really blocking out those people because we have to fit into the current model, which you know, requires a clinical indication. But like, what you're going to have by and large is people are just going to lie and say they have a clinical indication. Like, you know, I can't tell you how many of the classic example of this is, how many kids did you know in college? Maybe this was just my college. That you go to the you know to the psychiatrist and you say, I have trouble focusing, and it's like, no, probably you're eating like a lot of sugar. It's causing hyperactivity in your brain.
Your sleep.
I just had my friend who, her Instagram handle is V's Honey. She's one of the biggest influencers that talks about Adderall detox and her whole journey with that. And she's used psychedelics as a part of her recovery, but has some really specific thoughts on the actual indication and diagnosis of Adderall versus like looking a few layers back, what's causing that actual like hyperactivity in the brain that's causing lack of focus. And so anyway, it's more just a comment rather than a question, but just I'm excited to see how this space evolves, because I know a lot of people that benefit from ketamine that don't have a clinical indication, and people that are applying for these programs and kind of, you know, twisting their answers because they want to be able to have access to these medicines. So
yeah. I hope that we're all evolving in the way that we understand mental health. And when we're, even as providers, we do a lot of teaching in our practice to new clinicians. When I'm meant to diagnose somebody and I'm taking a diagnostic perspective on care, I'm asking questions like, how's, you know, your level of worry? Are you not enjoying things? Are you angry all the time? Are you upset? I'm not asking questions like, what are your favorite things you like to do? What inspires you? What motivates you? What are the strengths in your life? You know, and we do that therapeutically, but most psychiatrists, unfortunately, the standard of care is so low. It's just, let me check these boxes and then pick the medication that matches this, you know, 3-digit diagnosis code. And it limits our ability to empower each other and to find healing and growth, rather than make people sick and limit their own kind of ability to not need the doctor anymore. You know, that should be the goal for every physician, is that you shouldn't need to see me anymore, right?
Yeah.
We should give you the tools to be able to heal and help yourself. I think that's what this whole change is doing for the community.
Definitely. A few questions on the personal side, and then we'll kind of like start to wrap it up. But psychedelics in general, outside of just ketamine, how do they make their way into your personal life? What is your use of them? And that can be across, you know, ceremonially, therapeutically, recreationally, microdosing. Would love your kind of personal opinion. We've had probably 15 plus people come out of the psychedelic closet on the podcast and share a lot about their experiences, which has been really powerful. So I'm very curious, you know, if and how these make their way into your life.
Sure.
Sam's a saint. He's
I've never tried any of these things. No, I'm kidding.
I was like, well, really?
No, I get this question very often from patients.
Yeah.
Have you tried this? And I'm honest with my patients. I have tried ketamine, and it has helped me tremendously. I feel that in times in my life when I've had acute anxiety, difficulty with overwhelming stress that I wasn't able to manage, those experiences allowed me to prioritize what was important in my life, and to remind me of my calling as a healer, and to allow everything else that's not as important as that to fall, you know, to the through the cracks, so that it's not in my consciousness or awareness, so that I can process that and let it go and refocus. So for me, you know, every few months is an ideal time to get that reset. And we can call it clinical depression or anxiety. I think I could probably subjectively diagnose most people with depression or anxiety. But for me, it was just prioritizing the wrong things at times in my life that were challenging, allowing me to reset that. This has been a really helpful tool.
And only ketamine, or do you engage in other psychedelics?
Sure. So in my experience, to be honest, I mean, I was exposed to psilocybin from my undergrad at Johns Hopkins in clinical study. So I was kind of straight edge growing up. Didn't even drink alcohol until I was 22. So this whole field of medicine kind of rocked my world when I was exposed for the first time. And I think, it's comfortable for me to point to psilocybin in many ways as a way that helped mature me through my 20s into my 30s, and relinquish all of the insecurities and feelings of doubt and perceived judgment. So that happened by accident, to be honest. I didn't even really put two and two together until I kind of went back into the research and the studies of, wow, that wasn't just an accident that I felt better after my first psilocybin experience. Beyond that, to be honest, I haven't tried much of the others, the ayahuasca ceremonies and the DMT and LSD. This is all new to me. As a medical professional, I'm excited to not only learn more, but try these things and eventually get to a point where it's all clinically trialed and the access is available in a way that's clean, safe, and consistent as well.
Derek, how about you?
On the other end of the spectrum. Psilocybin, microdosing was a big part. I don't do it much anymore, but was a big part of my life for probably like 2 or 3 years, 2 years. And I do ketamine probably like once a month, sometimes twice a month. And that's in like ceremonial, ritualistic kind of, in treatment. Psilocybin, I think the first time I did psilocybin, I was like 19 and it was way too much. And, that kind of turned me off of psychedelics from like up until I was, 10 years later.
Such a common story.
Yeah. I mean, I was with a few friends. They put it all on some pizza. And it was probably an eighth on each slice. We went to, it just wasn't the best experience. It was a lot. And it kind of traumatized me from doing psychedelics, other than going to Burning Man and a little experimentation there with all kinds of things. But recreationally, I don't do, like if I'm going to like once a year or twice a year, like on New Year's or at a festival or something like that, I'll do some other things, but primarily just psilocybin, microdosing here and there, and then ketamine for therapeutic.
Okay.
I'll tell you, if it was legal and prescribable, I'd be, first person to try these new modalities as well. If you know some, safe, legit avenues, like that's what society needs, right? Because you get a lot of the underground shaman, the Hollywood shaman, who might not have the right preparation for you, might not have the right substance for you. We look forward to the day where we can use our whole therapeutic modality across different psychedelics. So when we're speaking of healing, ketamine is fantastic. When we're speaking of growth, psilocybin is fantastic. When we want to focus on love, MDMA is such a heart opener that will help so many people through sexual trauma and other types. And then, we all know about the benefits of DMT and LSD to expand the mind into that self-transcendent state. Mm-hmm. So while our protocols are all focused around ketamine right now, we'll come back in a few years when you've got 50 million followers and maybe you won't even invite us back, but we'll be excited to share how we can medically help people with these different modalities in a way that's not risky.
Yeah, and just like a brief plug on this, as you guys both know, we're doing an event tomorrow to launch our nonprofit that's focused on the legalization of microdosing, with the intent that harm reduction from unsafe access to these substances is not only prohibited from people having access to quality product that can enhance their mental health, but also, as you mentioned before, fentanyl is rampant, especially in LA. We've heard so many stories around people taking substances that were laced with various other substances, and psychedelics are on the rise because they're really helping people, not only in the clinical setting, but also in recreational consumer product world. It's wild what's happening. There's thousands of brands shipping all across the United States and Canada. And I really believe in cognitive liberty, people having access to these products, but in a safe and vetted way, just like we would take, any supplement. And so anyway, we'll see. It's a long pathway to, increase legal access to Schedule I substances, but that's the intention. So excited to continue that initiative, and we'll all kind of fields will combine, I'm sure.
And that's the beauty. I think we're all on the same team, right? How do we get these healing modalities of the world to expand consciousness in a way that is so needed right now? And whether it's each their own, whether that person wants medical guidance because that's how they feel safe, whether that person has the right person in their life to guide them through this. I'm an advocate of all of these modalities as long as it's done very intentionally, not impulsively, not accidentally, not by pressure or force, and not just on a whim that like, let me just see if this will help me. There's a very curated approach that I think all of us are figuring out together and contributing to each other's protocols so that hopefully one day this isn't something you have to go to the doctor for only, but if that's the right fit for you, that option will be there.
I think the world is like, the world is messed up right now, right? And people think like, oh, I have, they're going through a lot or absorbing this, or empaths are really absorbing a lot of the incredibly traumatic things. It's not just our country, right? It's all around the world. There's craziness, and I think that people, like, are having these mental health issues and stressors, and then like, oh, now it's what's wrong with me and this and this. Like, I think we live in a crazy world, and now let's help each other of like how we can process it. It's like we're a byproduct of of our environments, right? And then of these things and how we process things and how we grow from things. And while we're living in very I think there's also a lot of amazing things happening in the world, but we don't see that on the news, and that's not really talked about. But there's a lot of very catastrophic, regular things happening, and being able to be there for each other and finding different health modalities, and some people's approach or some people's medicine is going to be different, but really it's like that community of like making people know that that they're not alone, and that it's okay, that like this is affecting a lot of people, and like we can all get through this together.
I have a few final questions for you guys before we wrap it up.
Yeah.
One, just briefly, if you guys had one sentence, you can each answer this, of what makes your partnership work.
That Mother Goose voice.
It was very calming.
So soothing.
So soothing. You'd be a great meditation app host.
Yeah, thank you.
Yeah, he's just good at everything.
Yeah.
We have an excellent balance, and this is what we preach, right? Finding harmony and balance. We found it in each other. He's got an engine that never stops. I keep him kind of like grounded, and then he revs me up and motivates me when I'm a little too grounded, right? So balance and harmony, man. I love you, brother.
Love you too.
Eric, what's your answer?
He's just he's such a special human being, and the way that he's like a walking ketamine experience, like it can shift the perspective or see things from a certain point of view. And really, like the first time we were having a business meeting, supposed to be, next thing on the whiteboard he's life mapping me from birth to where I'm at, of every traumatic and positive event. And I'm like, wait a second, how do we get here? And just is really I was looking for somebody like Sam for about 2 years when in building this, and trying to find a doctor that was actually healing people, which you would think would be a lot, or passionate about helping get people off of medications, about healing people, and what you think would be a lot more common than it is, but it's not. And he kind of was like, I feel like I kind of manifested like this little. This perfect little human being to help build this with. So yeah,
I'm blushing. The universe really aligned, and thank you for bringing us on to help advance this education. Everybody that Derek introduces me to is amazing, and I just think there is a network of people growing and growing in this field, that the more we're giving, the more the world receives.
I totally agree. My last question for you, and then we'll share where people can find you and what's next, is I would love you both to answer this as well, but what is the most important lesson, any psychedelic? Most people that come on this podcast are sharing about the range of everything from ketamine to ayahuasca, psilocybin, DMT. What is the most important lesson that psychedelics have taught you?
It's a deep question.
Don't kill yourself.
Wow. Yeah, I mean, I hear you laughing, but that's real.
Oh.
Yeah. Thank you for sharing that. I think stay aligned with what your true purpose is. We get so distracted in society, from our cell phone habits to our social habits. But if you understand what your interests are, what your skill sets are, and what your experiences are that life has created for you, and you can allow those three things to line up, you find your purpose. And psychedelics will remind you that every time you need a reminder.
Beautiful. All right. What is next for you guys? Where can people find you? Anyone that wants to learn more about either of you two individually or Better You?
So we'll start with the website, betteryoucare.com. It's better you, just the letter U, care.com. And that's where we can do our at-home ketamine initiation if anybody wants to go on and do a free intake. We just launched our foundation, betteryou.foundation. And this is all about just continuing to increase awareness in the mental health community about all of these alternative modalities and helping bridge access for anybody who has obstacles. So we launched what we called a Pay It Forward program, where if you don't have means to care or you don't have health insurance, we'll see you for free. It's actually not free. We say you have to pay it forward by doing 3 acts of kindness in the community, writing a letter about it, and bringing it back to us.
And that's for multiple, like for people, like we said before, one thing, it's not one shoe fits all, right? So for that's breath work, yoga, meditation, nutrition, psychotherapy, psychiatry. So bringing together and collecting healers from all different modalities and across the country, and then we have student volunteers and pre-med student volunteers to help connect people with different
all the care they need. Yeah. And then our social channels, at Better You Care, at Dr. Sam Zand,
at Derek DDD. Love that. What all the D stands for?
my initials, just the initials.
Oh, that's a good point.
Derek Daniel Du Chesne.
Oh, got it. Yeah. Amazing. Well, I'm so glad we got to talk. I learned a lot from this episode. I'm really excited to share it with people, and I'm going to send this episode now to anyone who asks me all of the range of questions that I asked you about ketamine, because I'm really excited about these answers, specifically on the dosing and the safety and what's happening in your brain. I think this is going to be really informative for a lot of people, and I'm really excited about all the work you're doing. So thank you. And more to come. We'll have you back on as your journey progresses, and I'm super excited about everything you're doing.
Thank you so much. And thank you for tapping into your beautiful journey. You're doing a lot of great work in the world.
Thank you.
Thank you for decorating this room. It's amazing.
Mushroom den.
Yeah.
You know?
And another place that people will be able to find us. So we're opening up a location in Santa Monica in the next month. So for brick and mortar, can come here, or if you're in Las Vegas, we're at 4029 Dean Martin Drive, and can come. Or what's the new address across the street?
4040 Dean Martin.
Oh,
yeah. And this is a place where you can meet your provider, you can do the breath work, you can do the meditation, you can do the vibrational healing, the sound healing. All of the modalities will customize what works for you. And then you can take the treatment home and continue at your own comfort and convenience.
Amazing.
Yeah.
All right, guys, more to come. Thank you so much.
Thank you.
Awesome. Thank you.
Thanks for diving into the multiverse with us. If you're interested in being a featured guest on the show, sponsorship, partnership, or you're just mushroom curious, we're always looking to expand our mycelium network. Be sure to follow us on Instagram at Into the Multiverse, where you can find clips from this podcast, psychedelic legalization news, events that we're doing, and so much more. In addition, we've also created the world's first ever mushroom-specific marketplace called The Multiverse, which you can find on Instagram at Multiverse or online at yourmultiverse.com. We've also created our own in-house consumer lifestyle brand called Supermush. We make mushroom mouth sprays. We make a whole line of mushroom streetwear. You can find it on Instagram at Supermush or online at supermush.com. We'll see you next week. Much love.